Minnesota hospitals are under stress to care for adults during the current surge of COVID cases, and pediatric hospitals are feeling the pressure too.
The Minnesota Department of Health reports 131 pediatric ICU beds are in use statewide right now, with only 15 remaining open. Kate Radich spoke to a doctor about what you should consider if your child needs care.
State Health Department data shows 7% of the Metro's pediatric ICU beds are available.
In the last week, we've been averaging about 20 patients a day at Children's Minnesota who have tested positive for COVID-19 and who need to be in the hospital.
Children's Minnesota's Dr. Gabrielle Hester says there is a common misconception that kids don't get sick from COVID-19. Children are lower risk compared to adults to have severe complications.
So unfortunately, I have firsthand seen how seriously ill children with COVID-19 can get.
Dr. Hester says kids being hospitalized are having trouble breathing or have developed something called MIS-C, a multi-inflammatory system complication of COVID. Experts say the best thing you can do to protect your child is to get them the vaccine if they are eligible. And the state also offers monoclonal antibody treatment for certain kids. Right now, the Minnesota Department of Health says it's offering antibody treatment to children over the age of 12 who are at risk for severe COVID. But the FDA recently expanded eligibility to include the youngest pediatric patients, even newborns. Dr. Hester says in addition to COVID, they are also seeing a lot of patients with RSV and an uptick in influenza cases. She encourages families to seek care if their child is sick, but determine if there is a better option before going to urgent care or the emergency department.
Many times, the pediatrician or the outpatient clinic will be well equipped to take care of your child and get the help that they need in the time that they need it.
Kate Radich, WCCO 4 News.
Medical work is underway to determine the risk criteria for those monoclonal antibody treatments in children under the age of 12.